From that first visit to then treating and seeing the progress, it was like a complete 180 turnaround. And so that'll always stick in my head.
Wow.
I know, that's what it's all about. So regardless of your background or what kind of specialty you're in, patience, that's what it's all about.
Right, and we want to build relationships with them. We want it to be special, and the cool thing is we get together at these meetings twice a year at the SCPA CME meetings, and as colleagues we can talk to each other about building those relationships, how we do it, and how we find solutions for these patients, these human beings that are our patients.
Yeah, we heard so many different stories, but really it's like one patient, one purpose.
My name is Fasiha Raza.
Jamil Waters.
Abby Jacobson.
Corey Whitesides.
A lot of patients stick with me in my mind and in my heart from my 15 years of clinical practice. But the first patient that comes to mind is a young man. He was in his 20s and he came in for a rash, a contact dermatitis. I'm gonna fix your rash, but what is that dark spot on your leg? And he turned around like he was looking for his tail. And he said, "What are you talking about?" I said, "Oh, don't worry, I'm gonna fix your rash, but that needs a biopsy." And sure enough, it ended up being a melanoma.
I treat a lot of hair loss, and in particular, pediatric, when I see alopecia areata, it's really, really tough. She had over 50% involvement. Alopecia areata came in with a wig. And this is like a 4 or 5-year-old, mind you, and so that's very traumatizing at that age to have to go to school with a wig. Mom was emotional, child was emotional, and just that big reveal when that first visit, when they removed the wig, and you have to try to hold your composure because you get emotional too just thinking about it.
I'm constantly reminded of this. Patient, she shared a recent cancer diagnosis with me. It was terminal. I don't think she would just tell anybody that type of stuff. She really treats me kind of like family. I don't think her life expectancy was going to be long, but she said, "I just want to really thank you for your care for me." She wanted a hug. Gave her a hug at the end of it, and we almost cried together.
I had a patient who had some dark eye circles and some puffiness under the eyes. And this is one of the concerns that I see very often. And she was very insecure. We talked about different options that were available. And luckily, when we went through those processes and I met her again at her follow-up, she was super happy on how things had turned out.
I just always think back to what would have happened if he hadn't had some contact allergy and came in that day. He had just gotten married, came back with his new young wife, and was petrified. Very sweet, told me I saved his life.
And to be able to make a difference and actually see the hair grow back and the parent cry, the child cry, it really does stand out.
If you dig enough and ask the right questions, you will find at least one piece of information from each patient that'll just floor you and be like, "You are so unique of a person."
I can't tell you how many times I have said that phrase, "I've got you."
We are here for you. We're here to treat you. Our purpose in life is to see you get better.